All right, doctors, Dr. Josh Wagner here, and I have a special interview, video interview for you, holiday special with Dr. David Lang. I'm really excited to share his story with you because so many doctors can relate, no matter where you are in practice, whether you are just out in an associateship, in your practice in your first year or 20 years, you've probably had some of the experiences he had. He's doing phenomenally well right now, and I know it's not going to change, and the rest of his career is just going to be more and more beautiful. So I'm going to introduce him so he can share his story, so some of the mindset shifts he's had, some of the strategies he's done in practice, you can take on and take from and apply it to yours, and you're going to see it the same, because it doesn't have to do with where he is. It doesn't have to do with his technique. It has to do with what's going on up here and here. So I'm going to attempt to screen share right now, and hopefully it doesn't go all funhouse mirrors. Let's change this. Nice. So, Dr. David, thank you for taking time out of your, I know we were just talking before this, busy pre-Christmas week to share your story with chiropractors. So you started off in practice on your own, was going fine, but some other circumstances caused you to have to sell that practice. And then when you got back in professionally, you joined a practice as an associate for 4 years. And that wasn't the greatest of experiences. So can you start there? What was it like during that 4 years? What made it not a great experience?
Sure, absolutely. First of all, thanks for having me on here, and I hope to maybe shed some light on what we're doing. So, I'll have to first say that the experience with the people I worked with was great. It's phenomenal people. What I didn't like about my position as an associate there was all of the work, all of the effort, and then there's no fruit from the labor. So that was just a hard thing to swallow, and I realized what I'm putting in, I'm not getting back out. So I wanted to get more out of it. I think that's a goal behind anyone who's in an associateship, is to either take over, buy out, or move on to something different after you gain a few years of an experience. I don't know if I've ever met anyone who just wants to stay in an associateship unless it just meets all of their needs. And at the time, it wasn't meeting mine. So I decided to take off and go on this adventure again.
Got it. And I'll include there, a lot of docs who may be listening to this probably aren't in associate positions because that's, let's say, a smaller section of the profession. Yet a similar mentality from what you said of you're putting out all this work, you're doing all this great stuff, and not seeing the return. A lot of doctors are seeing that, let's say, with insurance reimbursement. Getting the check back that says 19 cents when you billed for whether it's $40, $140, $240, like how frustrating that is. Trying to convince a nurse practitioner on the phone that your diagnosis and your objective findings deal it credible to give this service code, and the ridiculousness of they have no idea what you're doing and why you're doing it, why we're doing it. So a lot of docs have the same sense, even if they're not an associate, of not getting reimbursed. And then it could be, you know exactly what this patient needs. You know the difference it's going to make in their life. You know the value, but the patient says, I've got to think about it. Or especially now, like, oh, doc, with Christmas and buying presents, times are tight. Like, I can't afford it. I'll come back after the holidays. And we all know 99% of those people aren't coming back. So there's many different realms of doctors feeling, I'm putting out all this effort and not really feeling the return. So continue from there.
Okay. So when the decision became clear to open back up on my own, I sat down one evening with my wife. We came to this conclusion that this was the best idea to move forward with. And then sure enough, it was kind of funny. I turned in my 3-month notice to the doctor I was working with, and then they actually let me go like a little bit later on the next week. So I thought I was going to be able to work out a notice, transition another doctor into the place, and it didn't end up happening that way. And so I go home on a Wednesday night with my hands up in the air, and I haven't been approved for the business loan yet. I haven't signed a lease anywhere, and I'm thinking, what are we going to do? So I was like, well, we got to do what we set out and planned to do. It's just that it's going to happen differently now. So what happened at that point, that was on January 3rd. And what happened from there is on January 4th or 5th, I began to get lots of calls and emails. Where are you at? I showed up. You're not there. To make a long story short, I went and applied at the city for a home occupancy, and got approved and took care of people, on house calls for 3 months until my building was built, and then immediately stepped into practice, stopped making house calls on April 9th and stepped into practice on April 10th with a full staff.
That's this year.
That's this year.
So we're talking 8 months ago.
Yes.
Yeah,
Yes.
awesome.
So we opened our first day. I think we opened on April 10th. Our first day we had, 24, 25 people. It just started with a bang, and then it's just gone up from there.
Cool. And before you continue on how great it's going right now, so you had that experience of you expected maybe to have a 2 or 3 months grace period. You let them know you're not staying on. They said goodbye. You're out on your own now, and that was January 3rd. So think about how many docs potentially in 2 weeks from now, it's going to be January 3rd, may find out that they're in or out of network with certain companies, and the deductible this year is $500, or 2017, and maybe 2018, that's $3,000. That makes a big difference. So just showing doctors that in 2 weeks, they may get a glimpse of what you were feeling of like, wow, all these people who had benefits, not so much in 2018, whether it's dropped, high deductible, like things change like that when you're in that system. So you just got to be prepared. This can happen at any moment, even when you're your own boss. So shed a glimpse on however much you want to share of like how well things have been going since you've started, and what do you attribute behind that?
Okay. Well, since I started, of course, for that little period, that 3 month period, I was making house calls. That was, it was all cash. And I went from an insurance based practice to a straight cash practice. And I think I was busier working at the house than I was at the office. Yeah. But what I realized and what's changed, I guess, is, with a cash-based practice, when you step into the room with a patient, you've got to think, how can I immediately meet their need? And that is the number one question that they have. That's the number one concern that you have, because they're already there. They're going to pay your cash fee, but are they going to pay it once, or are you going to be able to get them better? Are you, you got to, rub your magic hands and then just hope that they're going to walk out having a different feeling, because, you don't have insurance to lean on for a lengthy treatment plan to gradually get someone better and to rehabilitate and to restructure or reshape the spine. There's none of that. It's meeting their immediate need, what they want right then. And that is why I signed up with the PPFS, is because it talks about listening to the patient's need and being a better listener. And I felt that's kind of where my weak points were at. I was not a good listener. I knew how to treat and I knew how to take care of people, but I was a terrible listener. So I had to rehabilitate that. I had a lot of work to do on myself, and it just changed with the mindset when I went from straight insurance to straight cash for 3 months, and had a different approach. I realized that, if the setting is there for correction, then we can do it. But if the setting is just there to meet their immediate need of pain relief, we know how to do that too. And that's what we had to do.
Yeah. Now, I'm glad you're touching that. One, I love your non-ego of saying, like, I didn't know how to listen to patients, because most of us doesn't. That's what I teach, and I still work on it every day. And especially in this profession, it's so much of educate, push our information onto the patient. There's no listening that pretty much chiropractors I ever see being taught, and it's really what makes the difference, especially when patients are paying out of pocket. Now, you touched on a really strong point of meeting the needs of that patient rather than, let's say, convincing them or trying to fit them into our needs, which is we want you to understand the service and use it the rest of your life and tell your family and all that, which, of course, is great, but that's not going to happen early on.
Right.
But for docs listening, a lot of them here meet the needs of the patient And the doctors listening think, oh, well, the patients just want to come once or twice, get out of as much pain as possible, and never see you again. But there's a way to balance that it's not just quick fix, hopefully get them well in one visit, never see them again. Can you shed a little light on that?
Yes. So in the associateship position that I had, they had a structure for visit 1, visit 2, visit 3, and I won't say it was all bad. It's just a lot of it I like to function differently with. So there was a lot of clashing there, and just, hard to swallow this and repeat that and do this and feel good about it. So I didn't align myself with that very well. So what I did was basically just realize that, all right, you can get them in a treatment series and start meeting that need, but you're not going to really move forward anywhere with them until that, the very first pillar of trust and acceptance is formed. I mean, and that's what the whole platform of your patient care is based on, and it's got to have a strong foundation of trust, and your ability to take care of them when it comes down to it. Then once you build that trust, it's so much easier to open up their eyes of what other types of things you could help them with down the road. Because if you meet that need then, they will call you later. I found that out with a straight cash practice, and did really, really well. And if you do take care of them on those first visit or two and really get them out of as much pain as possible, they're not going to just quit, because the result they get initially is going to be something that they want to continue. So if they're a good candidate for that type care, just listen carefully, take good care of them, and then allow the educational components to come down the road when you've built a rapport and a relationship with them that they feel they can trust. And that's actually when referrals start coming. I mean, I was getting referrals out of my house, and with no staff or anybody. It was just me in the parlor room making house calls, So I think educating them can come. You just have to do it at the right time. But first, just take care while they're there.
Exactly. It's not about not educating. It's about when and how makes all the difference. And a phrase I really like to share, so again, because docs so easily in chiropractic, hear something and immediately make a decision. In terms of meeting their needs, you can meet the patient's needs, which is hands down, if you don't do that and if you don't communicate that, you've lost them. But you can meet their needs through your care recommendations rather than through their care wants.
Right.
Makes sense? So a lot of docs hear oh, meet their needs. Well, meet their needs, everyone just wants to be out as soon as possible. And so you can meet their needs through your recommendations rather than just meeting their needs through their quick fix, superficial wants. And it doesn't mean not everyone will be that, but there's a beautiful pathway to go that doesn't have to be this all or nothing, my way or the highway approach that's become so abundant over the last 30 years in chiropractic.
Right, because you want to share this with them when they have their listening ears on too. And when they're in pain on this first visit or two, they're not good listeners. No. They don't listen, so don't waste your breath trying to, get down the fundamentals and principles of chiropractic care and how you should be treating everyone in their family, or they can't be patients.
Yeah. So
they're not listening in the beginning, just take care of them, and that comes.
So it's about 8 months into your private practice in your new building. I know you had a few months that you were doing out of your house and it was going well. And I know last time we spoke, probably a couple months ago, you're just continually expanding, almost to the point where it's I got to change something. I can't take care of more people in the same time. Tell me what's most fun about practice for you now. Because I know it's not a grind. It's not of course there's things you got to deal with, and especially there's growing pains. But in general, I know you're having fun, and it's exciting to be in there, and patients love it, and they're referring, and they're, everyone's saying yes to care. Just share what that's like.
It's relieving and comforting. And it's nice because it allows me to focus on, spend some time focusing on growth practices and growth principles with, more effective care, different services to offer, just explore those avenues when you're not having to beat the bushes from club to two, going door to door business marketing or, holding talks or lectures or, hosting dinner with the doc or, something like that. That's the things that I'm just not good at doing. I mean, when I leave work, I want to go to my family, but, my patients also get my cell number. So if I need to meet them at the clinic, I was here last Friday, for example, and, it's fun because they'll call you if they really, really need you. But that when you step out from work, you can go do the things that you want to do in life,
Exactly.
Not worry about the business. It's going to take care of itself.
And that's really impressive to say for 8 months into a practice, rather than, a lot of docs 5-10 years, they're scrambling around. And it's not to discredit doing dinner talks or connecting with your community.
No.
Some docs love that. And if you love it, go for it. But that's obviously not what you want to be doing outside of your practice hours. And remind me, you don't have to give me specific numbers or share, but I think you had said when we talked last, maybe you were 6 months into practice, had you already met or exceeded your goals for your first year at the 6 month mark of what you were thinking or your capacity? Shed some light. You don't have to give your personal numbers, but.
Sure. No, we did. We sat down, my wife and I sat down at the computer. She helped me just kind of organize things in the beginning because she knew my head was all over the place. Yeah. So, and we have 3 kids, 3 beautiful girls. So, we had a lot on our plates. We set our goals for the year, the first year, second year, third and fourth. I think we went up to 6 years, what we want to be doing. And I think by month 3 or 4, we had already exceeded our second and third year mark for what we anticipated. So
that's about 10 times better than I had originally mentioned. I thought by 6 months you had exceeded 1 year. By 3 months you had exceeded the second year goal.
Yeah, we blew past it. We really did. And I'm humbled by it, but it was so exciting. I was able to, get a full staff in here so we're not, running like crazy. And that was nice too. So. And
that's all without running like crazy outside of the practice marketing. Cause that's oftentimes what.
I don't like marketing. That's not fun. No, marketing is not my strong point.
You're delivering great care. You're listening more and more to patients. You're communicating from a standpoint of where they can hear. You're connecting with what they need first. And you're doing what you know is right. And you're doing what you believe in here. And without that, now that's not the only answer. Yes, there's other things, but without that, things are always going to be a struggle. And they're always going to be a grind. So you have that foundational principle. And you've been so rewarded and blessed with how it's going so early. And like I said, there is no way it's going to change, unless you change for the negative, which I know you're not going to do. But there's no way it's going to change, and you should be really, really proud of that.
Well, I am, and we're really excited about it because, like I said, it's freeing us up and allowing us to do the things that we've worked so hard to want to do. So, have fun with our kids. And I still miss a lot of things here and there because we're always working. But you know what? It's fun work. It doesn't feel like we're nose to the grindstone 24/7. We enjoy being here, and we enjoy doing it.
Meaning you're always adjusting someone. You're busy.
Yes.
Yeah. That's a lot better than making calls. So thank you so much. I know your patients and community are extremely lucky to have you. And since you're so relatively new, a lot of them probably haven't even got the fortune to discover you yet. So that's even more exciting.
Well, thanks for having me on here, and I appreciate it.
Absolutely. I just want to give you, if there's anything else you wanted to share that you thought could make a difference to a doctor listening, any last thing you want to share?
Sure. Well, if there is someone listening that does find themselves in that scenario, or they're wondering what they need to do, I'll tell you, just to reiterate, it starts when you're backed into a corner and you realize you've got to only go one direction. And it really begins with a change between your ears. It seriously does. It's not in a technique. It's not in a management company. It's not in anything that you can go out and purchase. It just starts with what you already have and maximizing that potential until I realized that, and then realized there's so much more about that I don't think I've even tapped into. Then I don't think I would have ever, done what we've been able to do, very blessed to do. So It just starts right up here.
Thank you for sharing that, and I really loved how you began that when you're saying sometimes it takes for you to be backed into a corner, because so many people, let's say they're struggling and they're thinking, oh, this is just how it's going to go. Like, I've tried these new things, and it sucks to hear this, but sometimes it hasn't gotten worse enough. It hasn't gotten bad enough. It hasn't hit rock bottom until finally it's that wake-up call of, you know what, I've really got to change. I've got to do a 180-degree change. I've just got to drop this. And so not to be the bearer of it's going to get worse for someone who is bad, but realize that that's sometimes the biggest blessing in disguise, by hitting rock bottom and just saying, I've got to shift. And I've had that in my life, and who knows, there probably is going to be another one in 6 months. You know, it's a process of evolution, and you'll have it too, even though things are going well. It's never like this. It's like this.
Always that.
If you're doing well, it's still like this. So,
yes.
Thank you so much for your words and for sharing and your energy. Like, literally, if someone didn't even have the audio on, they could feel your essence. Like, I could feel it. Like, I would be comfortable and happy if you were the doctor in the room with me. Like, there's an essence about you, and
thank you.
It's not your haircut or shirt; it's who you are. So,
thanks. I appreciate that, Josh.
Thank you for that. I'll let you get back. I know you got a super busy day and week, and have a Merry Christmas with your family.
And you do the same. Thank you.
Thank you, David. We'll speak soon.
Okay.
All right. Bye.
Bye.